Hello everybody, welcome to my YouTube channel, Homeopathic Super Sessions by Dr. Jagos. Today we'll be doing something about, or we'll be knowing something about symptomatology. That is the study of symptomatology. This video is divided into two parts, part 1 and part 2. So today I'll be doing the first part. Well, in the introduction, as you all know, symptom is the language of the disease. If a person falls sick, you have to see the expressions of the patient. Expressions of the patient are to the signs and symptoms. Therefore, signs and symptoms form the language of the disease. It reflects the disordered functioning of the vital force. So naturally, when the person is in a disease state, the vital force will get deranged and the signs and symptoms will appear. And their full comprehension is essential for understanding the phenomena of the disease manifestation. So, hence, if you want to understand the patient as a whole, you have to understand the phenomena of the disease and its manifestation through the expressions, that is the signs and symptoms. So as you all know, man is constantly being bombarded by the external environment, and the vital force will try to resist these changes and will try to maintain health or harmony. But when the sense of adaptation is lost, then the disease state comes into play. So when the disease state comes into play, we have got disharmony. So at one side, we have got health. On the other side, we have got disease. One side, we have got equilibrium. On the other side, we have got disequilibrium. One side, we have harmony. And the other side, we have disharmony. So you can see the difference between the health form and the disease form. So therefore, in a disease, the symptoms will be the only language whereby you'll be able to identify the correct phenomena, what exactly is happening with the patient, and you have to form the totality. So in order to form the totality, there are different symptoms expressed by the patient, and each has its own importance. Basically, symptoms can be classified on a very general level into two big groups, that is the subjective symptoms and the objective symptoms. Now let us study something more about them. In the subjective symptom, they are experienced by the patient. So whatever the patient is feeling, whatever sensations he or she is getting, that is a subjective phenomena. So it is experienced by the patient. It cannot be verified by the physician with the help of his senses. So the physician cannot verify it with the help of his senses. Suppose the patient says, I have got throbbing pain in my head. So the physician cannot verify it by saying that the patient has got throbbing pain in the head. Why? Because the patient is feeling that sensation and not the physician. So naturally, when the patient comes to the physician to give relief to him, naturally the patient will tell you the truth. He will not lie to you. So therefore, subjective symptoms are very important symptoms, and they are expressed by the patient itself. And the physician cannot confirm whether it is right or wrong. And they are the earliest evidence of the disease. So when the vital forces just derange, whatever uncomfortable feeling, whatever ill sensation the patient is getting, the patient will experience it in the form of a subjective symptom. So the slightest derangement of the vital force will give you the earliest evidence of the disease. It attracts the physician's attention on which the individualization is based. So whatever subjective symptoms the patient is telling you, as you all know, homeopathy is a super specialty because it is the only system of medicine which deals with individualization of the patient. So therefore, from the subjective symptoms, we can form the totality of the symptoms on which individualization is based. Now, objective symptoms, they are also known as the signs. Out here, they can be really readily be verified by the physician. So whatever signs the patient has, either the patient can see it or the patient cannot see it, the physician's trained eye will be able to identify the signs. For example, patient has got redness of the eye. So it is an objective symptom. The eye is red. This the patient will also know as well as the physician will also see. But it may so happen that the physician's trained eye may suddenly find some swelling around the throat region or around the neck region. And when the physician palpates the thyroid gland, the degradation test is positive and the thyroid gland is enlarged. So out here, the the patient doesn't know that his thyroid gland is enlarged, but the trained eye of the homeopathic physician could identify this objective symptom that that the thyroid gland is enlarged because the physician has seen some swelling in the region of the throat or on the region of the neck. So, since they can be verified by the physician, they are more reliable as compared to a subjective. In a subjective symptom, what will happen? The patient will only feel the symptoms. It cannot be verified by the physician. Whereas an objective symptom, it is seen by the patient many a times, or if it's not seen by the patient, it can definitely be seen by the physician's trained eye. Hence, signs which are of a non-diagnostic type are of great importance in prescribing. So in homeopathy, we have to take the peculiar, rare, queer, strange, uncommon symptoms or signs which are of the non-diagnostic type, which are important in prescribing. For example, saddle-like appearance or mottled appearance around the nose and on the both cheeks. So we can say sepia may be the probable remedy. Vertical furrows of the forehead, we can say that the drug is lycopodium. Okay, so these signs may sometimes indicate to you the remedy also. So at times they may indicate the remedy straight off. I've just given you these two examples of sepia and lycopodium. Now, objective symptom is important in the following conditions. So there are a few conditions in which the physician will only rely on the objective symptoms. Why? Because the subjective symptoms are not possible to elicit. For example, in infants, so if an infant is there, of course, if the mother is there, the mother will tell you everything about it. But certain signs are there which the physician may see, in which the mother is unable to tell you. So objective symptoms are important in infants, in unconscious patients. So in an unconscious patient, see how the patient is lying, what is his position, what are the state of the pupils, how is his breathing pattern, does he respond to deep touch or superficial touch, and so on and so on. Or even in uncooperative patients who are not very cooperative with the physician, sometimes we have to only rely on the objective symptoms, the way the patient is behaving, the way he is acting, what is his interaction, how is he interacting with the physician, his friends, his relatives, etc. Even in mentally deranged patients, in such instances, naturally, in the patient who is mentally deranged, he or she may not be able to tell you the symptoms. So see the way they behave, the action, and accordingly can prescribe. For those who cannot communicate because of language problem. So people may be having a language problem. The patient knows Telugu. You do not know Telugu. You only know Hindi, Marathi, and English. So again, with this barrier problem of language, you can again rely on the objective symptoms. So these are instances in which you can rely on objective symptoms. That is, in infants, unconscious patient, uncooperative patient, mentally deranged patient, and people having a language problem. So a complete element of the symptoms are location, sensation, modality, with or without concomitant. So you have to see what is the location. That is the area, the system, the part, or the organ affected. Then see what type of sensation he or she is getting in the particular part, organ. See the modalities. The modalities importance are given to the causative modality if elicitable in a case, that is ailments from. So ailments from, say, example, head injury. After the head injury, the patient's memory is very weak. So you have got a very strong positive factor of ailments from head injury, which is correlating to the memory weakness. Or you may get even the aggravating factors as well as the ameliorating factors. So we have to try and find out if in a case the ailments from are available. If not, the aggravation and the ameliorating factors also should be obtained or elicited. And lastly, the concomitant. As you all know, concomitant symptom is that symptom which has no pathological relationship to the chief complaint or physiological relationship to the chief complaint except the time of occurrence. So if a concomitant is there, sometimes an important concomitant symptom can clinch the remedy. So a symptom should be complete with respect to location, sensation, modality, and the outcome. Now, in the evolution of symptom, as nothing can be known of disease except to the signs and symptoms, its presence will be made known to us by the change in symptomatology. So, we have to let us see how does a symptom evolve. So, for that, we have to see the changes which are occurring. So, the changes which are occurring are generally seen in 4 stages. So, the disease is manifested in 4 stages. So, let us see what are these 4 stages. In the first stage, we depict the individual reaction of the patient, which will vary from patient to patient, and general symptoms like malaise, weakness, not feeling well be seen. Here, you cannot locate the site or the system or the part involved. So, in the first stage, meaning what? The vital force is just deranged minimally, and actually, the reaction to the minimal derangement of the vital force will vary from patient to patient. Hence, initially, you may just get general symptoms like loss of appetite, malaise, not feeling well, not feeling up to the mark, feeling lazy, feeling dull, and so on and so on. So, generally speaking, the miasm will be just sora. That is the beginning of the disease. And here, there is no such way where you can locate whatever system or organ or area is maybe involved. Okay, but only general symptoms are there which may be seen in many disease conditions. So in the first stage, it is just the derangement of the vital force with general vague symptoms which are not very characteristic in nature. Now, in the second stage, we will depict the disordered functioning of the affected organ, part or system without the structural changes. So out here, as the disease advances, you will be able to identify what organ is affected. And here you can come to know which organ is affected, but you cannot come to a definite diagnosis of the disease because all the biochemical investigations also will be normal. So in the second stage, if you investigate the disease, everything will be normal. Again, you are getting the SORA maybe in a slightly intensified form as compared to the first stage. So out here in the second stage, you are only getting functional disturbances without any pathology. And you can come to know which organ, system, part of the body is affected. In the third stage, it will depict the structural alterations of the tissues and the organs. So as the disease advances from the functional stage into the pathological stage, definitely there will be some structural alterations in the tissues and the organs. So here, now you can see the shift of the miasm from the SORA to the psychotic phase. It will permit a definite diagnosis of the disease and biochemical investigations will be abnormal. So out here, if you investigate the patient, you will definitely come to know something is wrong with what system, what part or what area, what location in the body, because the biochemical investigations will be abnormal. So in the third stage of disease, you can definitely come to a definite diagnosis of the disease. And in the fourth stage, it depicts gross structural alteration in tissues and organs, which will interfere with the proper functioning of the organs in the near vicinity and will lead to secondary signs and symptoms. So what happens in the fourth stage, as the disease goes on advancing, if the patient doesn't take any treatment or just ignores his health, then what will happen? The disease will go from the reversible pathology into the irreversible pathology, and also whatever organs are there in the near vicinity, they also may be involved. So directly out here, you are getting the pathology which is unreversible, hence the syphilitic phase. So in the fourth stage, you get the complications and the sequelae become very evident of the disease. So you're getting the first stage, second stage, third stage, fourth stage. First stage, just the initiation of the disease, no diagnosis can be made. Second stage, functional disturbances. Third stage, definite diagnosis can be made. Functional disturbances going to the pathology. Pathology is generally reversible. If ignored, if it goes into the fourth stage, the pathology is irreversible and the syphilitic signs and symptoms may appear. So now I want to tell you a note on the intensity of the symptoms. When can a common symptom also become characteristic? So a common symptom can become characteristic if the intensity is well marked. So an intense common symptom is important than a weak general symptom. So How will you know that it is intense? Because the patient will repeatedly in the interview constantly remind you of the same complaint again and again, again and again. So the intensity is well marked. So if the patient repeatedly goes on telling you the same thing again and again, then you know it is of a great intensity. So a common symptom also can become characteristic if the intensity is marked. Similarly, an intense particular symptom will be rated higher than a general symptom. So if a particular symptom also is intense, then it will be rated more than in a general symptom. As you all know, in homeopathy, we give importance to the general symptoms than the particular symptoms. But if an intense particular symptom may override a weak general symptom. So this is something about the note on intensity of the symptom. So please remember that a common symptom can become characteristic if the intensity is well marked. Now let us see something about the symptoms. Now what is a common symptom? It is a symptom which is seen in a large number of patients suffering from a particular disease, that is the diagnostic symptoms. So whatever the patient may be suffering from, a particular disease or a particular diagnosis, that is known as the common symptom. Or it is a symptom which is found in a large number of provers during the process of drug proving. So in drug proving also, whatever symptoms are found in the majority of the provers, they are known as the common symptoms. There are also symptoms that are found in many drugs. You may also find the symptoms in many drugs, and they become important only if the intensity is abnormally high. Otherwise, they are of little importance while selecting the drug. Excuse me. So basically, common symptoms can be defined in three different ways. Number one, it is a symptom which is seen in a large number of patients suffering from a particular disease. Excuse me. Suppose three patients are suffering from the same disease, then the symptoms, the general symptoms or the diagnosed symptoms will generally be the same. Also, it is a symptom which is found in a large number of provers during the process of drug proving. So when you prove a drug, a common symptom, for example, burning pains, may be seen in a large number of provers. And they are symptoms that are also found in many drugs, like loss of appetite, increased thirst, decreased thirst. These are again common symptoms which are seen in most of the drugs. And the common symptoms are only important for the diagnostic purpose. They are not important for the therapeutic purpose. They only become important if the intensity is well marked. Now, characteristic symptoms are those which characterize an individual. So in a characteristic symptom, whatever identifies or whatever individualizes the individual or characterizes the individual is known as a characteristic symptom. Their presence cannot be explained on the basis of diagnosis and the pathological changes that have occurred. So sometimes we cannot describe these symptoms on the basis of the diagnosis or the pathological changes which have occurred. And there are little value of diagnosis of the disease, but the intense value of finding out the correct remedy or informing the totality. And a peculiar sensation, beginning with the phrase sensation as if, is of utmost importance in prescribing. Suppose the patient says, I have got a sensation as if I feel my stomach is on fire, or I feel my body is made of glass, or whatever it may be. So therefore, any symptom which begins with sensation as if should be taken highest for evaluation. And also in the repertory, sensation as if by Ward and Robert has many sensations in which you will get all these symptoms. Now, chief symptom, it is the one that troubles the patient most and from which he seeks immediate relief. They can be considered as entering complaints. They are considered late to diagnosis of the illness. So a chief complaint is what? Is the one in which the patient wants immediate relief. They are also known as entering complaints because you are entering them or this is harassing the patient most in which he wants immediate relief. And they are considerable aid to the diagnosis of the disease. So from the chief complaint also, you may be able to find out what is the probable diagnosis. A concomitant symptom are those which accompany the chief symptom but have no relationship other than the time of occurrence. Their presence cannot be explained on normal physiological or pathological background. So And a common symptom, a concomitant symptom, cannot be explained on a physiological pathological background except the time of occurrence. And a strong concomitant symptom is sometimes very important to identify the correct remedy. Boning-Unson was the first to realize the importance of it. Later, Boger developed the idea more fully in Boger's Characters and Repertory. Roberts stressed the value of concomitant symptom with a modality common to the chief complaint. The further remote a concomitant is from the sphere of disease, the greater is value to diagnosis of similar remedy, and the mental concomitants are immense value in the physical ailment and vice versa. Frank Boardman stressed this point. So, the further away a concomitant is from the sphere of the disease, the greater is its value in therapeutics or to diagnose a similar remedy. Frank Boardman says that a mental concomitant is of immense value in a physical ailment and vice versa. So suppose in a physical ailment, say example, or suppose say in a mental ailment, patient is depressed, and every time the patient is depressed, or the patient will pass milky colored urine. So milky colored urine is an important characteristic concomitant. So only one remedy has that, depression with milky colored urine, acid force is the remedy of choice. Now, associated symptoms are those which accompany the chief complaint. It has no relationship to the chief complaint as regards the time of occurrence. So besides the chief complaint, we may also get another symptoms which are less in intensity or less troublesome to the patient, which are known as associated symptoms. Now, general symptoms are those which pertain to the man as whole. The patient uses the word I and not my. So when he says that I am not feeling well, it indicates the general state of the individual. They are classified as mental and physical symptoms. All mental symptoms are always general symptoms. Dr. Kent says the mental denotes the inner man and therefore lay great emphasis on it. So as you all know, Kent laid importance to the mental symptoms. He says that the inner man is affected, then only the outer man will be affected. Inner man is a will and understanding. First, the will and understanding is deranged, and then it will be seen to the physical signs and symptoms. Kent classifies mental symptoms into will, emotion, intellect, appraisal of perception, that is illusion, delusion, hallucination, and the subconscious. So this is the classification of the mental symptoms in this particular order. First important, the will, emotion, intellect, then appraisal of perception, if present in the case, and subconscious is the dreams. Thus, in a given case, the evaluation will be done as follows. So when you evaluate a case, you have to evaluate in order of importance. That is the mental general symptom, then the physical general symptom, and the particular general symptom, and lastly, the pathology. Boning-Unson says that the mental symptoms are difficult to fathom, especially for beginners, and prefers not to lay too great emphasis on it. He gave importance to the positive factors. So Boning-Unson said that he disagreed with Kent, saying that the mentals are very difficult to fathom. On the hands of beginners also, it is very difficult to identify the mental symptoms. So hence he gave importance more to the causative factor or the ailments from. Now, acute and chronic symptoms. Symptoms which are seen in acute troubles are known as acute symptoms, and symptoms which are seen in chronic troubles are known as chronic symptoms. So in an acute case, you know that it's of a recent origin, and whatever symptoms are there, they are of a high intensity and they are characteristic in nature, and immediately you can identify the similarities. Whereas in a chronic troubles, it is of a chronic case, it is a disease of a long standing. Patient may not forget, patient rather will forget to recap the sequence of events. It takes a long time to trace the picture of the disease, and a few symptoms may be characteristic, few symptoms may be common, and so on and so forth. So therefore, in a chronic case, you are getting a mixture of symptoms. You have to form the right totality by picking out the peculiar, characteristic, rare, common, strange symptoms. So that's all for this part. Second part will be coming soon. Hope you enjoyed this video. Thank you.